Which body system is most commonly affected in the patient with electrolyte imbalance? A. Cardiovascular system, B. Neuromuscular system, C. Renal system, D. Endocrine system. And the correct answer is B. Neuromuscular system. Electrolytes are the chemicals that conduct electricity when mixed with water. They regulate nerve and muscle function, hydrate the body, balance body acidity and osmotic pressure. Major nutrients involved in fluid balance are A. Vitamin B12 and magnesium, B. Fats and protein, C. Chloride and carbohydrate, D. Potassium and sodium. And the correct answer is D. Potassium and sodium. Retention of abnormal amount of fluid in the body due to retention of A. Sodium, B. Chloride, C. Potassium, D. Calcium. And the correct answer is A. Sodium. Fluid retention and excretion is based on osmotic pressure of fluid compartment. Sodium is the chief extracellular cation, so it maintains extracellular fluid balance. And potassium is chief intracellular cation, so it maintains intracellular fluid balance. Principal electrolyte of intracellular fluid is A. Calcium, B. Sodium, C. Potassium, D. Magnesium. And the correct answer is C. Potassium. Potassium is the most abundant cation in intracellular fluid. The amount of calcium in the blood is about A. 5 mg per dl, B. 0.5 mg per dl, C. 10 mg per dl, D. 100 mg per dl. And the correct answer is C. 10 mg per dl. Normal blood plasma concentration of calcium are 9 to 10 mg per dl. Normal level of sodium in plasma is A. 97 to 106 milliequivalent per liter, B. 135 to 145 milliequivalent per liter, C. 3.5 to 5.5 milliequivalent per liter, D. 14 to 35 milliequivalent per liter. And the correct answer is B. 135 to 45 milliequivalent per liter. Normal blood plasma concentration of sodium are 135 to 145 milliequivalent per liter. Normal serum potassium level in milliequivalent per liter are A. 2.5 to 3.5, B. 3.5 to 5.0, C. 5.5 to 6.5, D. 6.5 to 7.5. And the correct answer is B. 3.5 to 5.0. Normal potassium level is 3.5 to 5.0 milliequivalent per liter. Which serum potassium level requires no immediate nursing intervention for an adult? A. 3.2 milliequivalent per liter, B. 4.0 milliequivalent per liter, C. 5.7 milliequivalent per liter, D. 6.0 milliequivalent per liter. And the correct answer is B. 4.0 milliequivalent per liter. Important nursing intervention for a patient with hyponatremia includes A. Fluid restrictions, B. Provide isotonic saline, C. Administer potassium, D. Provide NG feed. And the correct answer is B. Provide isotonic saline. Administer normal saline, that is an isotonic saline. It is to replace sodium along with fluid deficit if present. With serum sodium level less than 115 milliequivalent per liter, clinical features includes the following except A. Lethargy, B. Seizures, C. Confusion, D. Cerebellum hemorrhage. And the correct answer is D. Cerebellum hemorrhage. The clinical features of the hyponatremia are personality change, headache, confusion, seizures, coma, dizziness, lethargy, hyperactive bowel sounds, skeletal muscle weakness, dry mucous membrane, etc. In following which is not a cause of hypokalemia? A. Vomiting, B. Potassium fasting diuretics, C. Renal failure, D. Aldosteronism. And the correct answer is C. Renal failure. The cause of hypokalemia includes deficient potassium intake or excess loss of potassium due to the vomiting, diarrhea, NG suction, excess diaphoresis, use of potassium fasting diuretics, polyuria, and aldosteronism in Cushing syndrome. Alkalosis and over-insulin also cause of hypokalemia, which moves potassium from extracellular fluid to intracellular fluid. Which purgative cause hypokalemia? A. Dulcolax, B. Liquid paraffin, C. Castor oil, D. Osmotic pressure. And the correct answer is C. Castor oil. Castor oil increases bowel movements, so it inhibits absorption of water, sodium and potassium from GI tract.